Do you know what a stroke is and why it happens? That's the question we're exploring today. A stroke, often referred to as a brain attack, is a medical emergency that occurs when the blood supply to a part of the brain is interrupted. The result? Brain cells begin to die within minutes, leading to potential brain damage, disability, or tragically, even death. Let's break it down further. The two main types of strokes are ischemic and hemorrhagic. Ischemic strokes, accounting for about 85% of cases, happen when a blood clot obstructs an artery in the brain. On the other hand, hemorrhagic strokes, making up the remaining 15%, occur when a blood vessel in the brain bursts, causing bleeding. Understanding strokes is the first step in prevention. Now that you understand what a stroke is, let's delve into the causes of each type. Why does an ischemic stroke happen? It comes down to four main factors. First, there's atherosclerosis, which is like a traffic jam in your brain's highways. It's when fatty deposits or plaques build up inside your arteries, narrowing them and restricting the flow of blood. Next, we have blood clots. Picture these as unexpected roadblocks. They can form in the heart or elsewhere in the body and travel to the brain, causing a sudden halt in blood flow. Then there are emboli, the hitchhikers of the body. These are pieces of debris that break off from a blood clot elsewhere in the body and hitch a ride in the bloodstream to the brain. Lastly, vasospasm, a sudden narrowing of blood vessels in the brain, can be compared to a sudden detour on a road trip, disrupting the usual route of blood flow. These are the main causes of ischemic stroke. But what about hemorrhagic stroke? Why does a hemorrhagic stroke happen? Just like a balloon filled with too much air, high blood pressure can weaken the walls of your brain's blood vessels, making them prone to rupture and bleed. This is one of the main causes of a hemorrhagic stroke. Imagine a weak spot on a garden hose bulging out under the pressure. That's an aneurysm in the brain's blood vessels. Over time, this bulge can weaken and burst, causing a hemorrhagic stroke. But it's not just about internal factors. External forces like a severe knock to the head can also cause blood vessels to break, leading to a stroke. And then there are brain tumors. Picture a slowly growing mass pressing against the delicate blood vessels in your brain, causing them to burst and bleed. These are the main causes of hemorrhagic stroke. But how can you lower your risk of having a stroke? What factors increase your risk of having a stroke? Let's delve into that. There are both modifiable and non-modifiable risk factors for stroke. Modifiable risk factors are those you can change. They include high blood pressure, high cholesterol, diabetes, smoking, obesity, physical inactivity, excessive alcohol consumption, sleep apnea, and illegal drug use. By making lifestyle changes like eating healthier, exercising regularly, and quitting smoking, you can significantly reduce these risk factors. On the other hand, non-modifiable risk factors are those you can't change. They include age, as stroke risk increases with age. Family history also plays a part, as having a family member who has had a stroke increases your risk. Men are slightly more likely to have a stroke than women. Also, African Americans and Hispanics have a higher risk of stroke than white Americans. Knowing these risk factors can help you take steps to lower your risk. But how can you recognize a stroke when it happens? How can you recognize a stroke? Well, there are several telltale signs that could hint at a stroke. One of the most common symptoms is a sudden weakness or numbness in the face, arm, or leg, especially if it's concentrated on one side of the body. This might be paired with difficulty speaking or understanding speech. Another sign could be sudden vision problems in one or both eyes. You might also notice an abrupt onset of dizziness, loss of balance, or issues with coordination. A sudden severe headache with no known cause can also indicate a stroke. It's important to understand that these symptoms typically occur suddenly. If you or anyone around you experiences any of these signs, seek immediate medical attention. Quick action is vital to minimizing brain damage and improving recovery. Knowing these signs and symptoms could save a life. Remember, time is brain when it comes to stroke treatment.